All right, today I'll be talking about antimicrobial resistance in India. So the topics I would be covering is the global AMR, the AMR antimicrobial resistance in India, what has changed in antimicrobial resistance pattern in last 5 years, global efforts that has been undertaken by World Health Organization to counter antimicrobial resistance, and efforts in India to counter antimicrobial resistance. So when you look at the human and economic costs of AMR, I think you would be dreaded to see that there are around 700 deaths happening every year due to antimicrobial resistance worldwide, and this follows only diseases like cancer, which seems to be the leading cause of death at this point of time, and followed by diarrheal disease, and followed by diabetic complications and road traffic accidents. So I think antimicrobial resistance is getting there to the top list. So it is still in 7th to 8th place, but it may soon reach the top places. So right now, as we see, it constitutes a staggering 700 deaths per year. So the predicted the sort of projections that would happen in 2050 if the rate of antimicrobial resistance is continue at the same alarming rate, it would constitute around 10 million, and this would exceed the cancer deaths, diabetic, diarrheal disease, and road traffic accidents. So, and in 2050, the prediction is there would be a continued increase in the resistance, and it would constitute up to 10 million deaths every year. And this would reduce the GDP of any of the global GDP to 2 to 3.5%, and that would amount to 100 trillion US dollars. So that's the economic impact that antimicrobial resistance would have on the economic scale. So if you look at deaths attributable to antimicrobial resistance every year, so as you see, the Asia constitutes. So if you look at the global sort of a layout of this antimicrobial resistance, I think Asia leads the scale. So you would have 4.73 million deaths that would happen. So amongst 10 million deaths that you saw in 2050 as a projected number, so the predominant number would be in Asia, because antimicrobial resistance would be highest in this part of the world, and this would be followed by African countries, and this would followed by Latin America. So North America would follow, and Europe would be the last one. So what essentially this projection depicts is antimicrobial resistance is more of a worrying concern and a serious concern in our part of the world if the rates continue to increase due to irrational, erratic, and inappropriate usage of antibiotics, which almost always is the cause of antimicrobial resistance. So, and as we see in Asia, if you take Asia, I think India remains the hotbed of antimicrobial resistance, because I think as a country, has been at the forefront of antimicrobial resistance. And we saw that in New Delhi metallo beta lactamase, which was first detected in India in 2006. And this was followed by recognition of these MDR strains, and in more specific, the NDM strain appeared in China in 2008, and after this it appeared in Europe, and last was America to be touched by this NDM strain. And what this all leads to is exponential increase in the sale of reserve antibiotics. So if you look at the carbapenem consumption globally, and you would see that India leads the list, only exceeded by Pakistan and maybe Egypt. So short of it, I think India seems to be at the forefront of increased consumption of carbapenem. So what it essentially means is there is more MDR infections, so you are resorting to utilize your last reserve antibiotics for these infections. And if you look at total antibiotic consumption, even barring the reserve antibiotics, so you would see India is still at the forefront, and this is the gray shade is the 2000 data, and the blue one is 2010. As you see, there is a staggering increase in the total antibiotic consumption, and India seems to be leading even the China, and this is closely followed by USA, which means India is really becoming a hotbed of increased antimicrobial resistance and relentless and inappropriate and indiscriminate usage of these reserve antibiotics. So now the question remains: is there light at the end of the tunnel? Because we are running out of antibiotics. So is there any hope at all we have? So the answer is probably yes. So I think the reason why we say yes is because of these evolution of these superbugs. I think World Health Organization has put in a lot of efforts, and even Indian government to that effect has taken a lot of efforts and has opened up their antes to really curb this menace. So what this essentially led to is in 2017 the World Health Organization came out with the list of organisms that needs to be tackled as a priority, and they sort of stratified these organisms into three priorities: priority 1, priority 2, and priority 3. And as you see, all the priority 1 organisms seems to feast in our country. So Acinetobacter comes in priority 1, Pseudomonas, carbapenem resistant Pseudomonas, Enterobacter species, carbapenem resistant species, and ESBL producing organisms. So all these are very are very much common and very much prevalent, and I think all these organisms have found home in India, and these come in the priority one. So if you look at gram positive, the MRSA and Enterococcus infections, which we commonly see in our part of the world, comes in priority 2, which is considered as high priority. Priority 1 is considered critical priority. So World Health Organization came out with this document as to all the measures that needs to be put in place to tackle the antimicrobial resistance. So what are the recommendations? They came out with the 10 sort of domains which need to be focused to curb this menace of antimicrobial resistance. The first one is public awareness. So creating public awareness of the risks involved with antimicrobial resistance, and dissuade them in discriminate usage of antibiotics, or over the counter purchase of antibiotics, or over the counter indiscriminate dispensing of these antibiotics. I think this public awareness will go a long way in curbing this menace of antimicrobial resistance. And I think, friends, I think what we need to know is more than the antibiotics that are being used in humans, I think the same amount, or if not maybe more, antibiotics are being used in poultry farms or in the livestock industry and in various other sectors in the environment. I think there has been a renewed and rejuvenated focus in curbing the use of these antibiotics in these livestock farms and in other industries where antibiotics are used indiscriminately. And we are aware in India, in poultry farms, colistin is mixed in the poultry feeds, and which is also one of the reason for increasing in the antimicrobial resistance that is prevailing in the community. And third most important thing, having a nationwide network of surveillance so that all the emerging antimicrobial resistance patterns are captured, and they are fed into a central repository, and this data is shared with the global agencies so that steps are taken to have a focal approach to the areas where antimicrobial resistance may be emerging or erupting. And most importantly, deploying human capital. I think this is another important area, trying to focus on putting a personnel who are trained in recognizing and taking steps in curbing the antimicrobial resistance. So investing on human capital is also one of the domain World Health Organization has put emphasis on. And obviously for all these measures you need monetary assistance. So they have come out with creating a global innovation fund to tackle this menace of antimicrobial resistance at the global scale. And most important, in a developing country or emerging countries like India, sanitation and hygiene becomes terribly important, because if you look at the smart study that came out few years ago, in India the community acquired ESBL prevalence is close to around 70%, which means it may predominantly be attributed to the sanitation and hygiene issues where there may be water contamination that may be happening. And most importantly, putting funds or efforts into identifying and developing the vaccines for tackling this antimicrobial resistance. And most importantly, to facilitate appropriate usage of antibiotics, we need to have rapid diagnostics, because Obviously, inappropriate usage of antibiotics may continue to happen until the cultures are available so that you switch over to appropriate or de-escalate or stop antibiotics. For that, rapid diagnostics, if you get an answer maybe within a day or within few hours, it will help us to identify the narrow spectrum focal antibiotics rather than using broad spectrum inappropriate antibiotics, which leads to emergence of antimicrobial resistance. And and about eighth point or eighth domain is obviously investing research into identifying new drugs that may be useful in saving lives when they are inflicted with these antimicrobial resistant organisms. And most importantly, having a good sort of a coalition between all the stakeholders and having a forum where the data is shared and suitable and appropriate steps are taken to curb this antimicrobial resistance, for which you need to have an international coalition. So what is the future pipeline hold? So as you see, when you look at the number of antibiotics that came out, it was pretty good around 3 decades ago. As you see, the number of new antibiotics that are coming out in the pipeline is slowly dwindling. And if you look at 2008 to 12, there's hardly any antibiotics that are coming out. So we are in dearth of any new antibiotics that can come out in which renders hope for us that we could fight these resistant bugs. So I think there was this headline about some new antibiotics that are coming out, and India also has come with a nationwide policy for national treatment guidelines for antimicrobial use. So this at least gives you a little bit of a blueprint as to or a or a or a or a pathway for any treating healthcare professional to uh, to to help him use appropriate antibiotics. So India in its efforts, so now you saw WHO has come forward and put in place this document, the 10 front sort of a program, and has identified the areas on which focus has to be made to curtail. So what has India done? So India has come out with a national action plan to combat antimicrobial, which is very good, I would think. So the whole purpose or the resolve was to prevent antibiotic misuse by the doctor community, by the healthcare community, and prevent antibiotic misuse by the patient community, and prevent antibiotic misuse by the hospital setting. So they come out with national action plan on antimicrobial. So this plan would be incorporated or would be implemented from 2017 to 21, about 5 years. So what it focuses is curtailing inappropriate antibiotic usage in the hospital setting, and obviously educating the public, healthcare professionals, and the hospital personnel about antibiotic stewardship and the steps to curtail this menace of antimicrobial resistance. And most importantly, I think this I would admire government of India, which has taken steps to curtail antimicrobial usage in the livestock farms, and curtail the usage or contamination of environment by this antibiotic effluents, that come out from the pharma industry. I think curtailing the contamination of this environment by the effluents that come out of the pharmaceutical industry, I think goes a long way, yeah, in curtailing, because this is beyond our healthcare community's ability to curtail these elements. So I think we should applaud our government of India in taking steps in identifying these two sectors where obviously as a medical community we may not have much of influence or much of our ability to curtail them. So what they have really looked at is to try to incorporate all these four elements, and which we are hoping to alter the prescription practice and hoping to alter the consumer behavior. And I think Indian government has also put emphasis on scaling up the infection control practices by extensive antimicrobial surveillance, which is one and the only way to curtail the spread of the resistant infections. And I think they have put in emphasis on tackling concerns on antibiotic misuse, as I already mentioned, in the hospital setting and in the livestock environment. So the JP Nadda came out with a blueprint which proposes what is the future plan and what is the global expectations out of India to for the steps to be implemented to curtail antimicrobial. So I think we should upload the steps taken by the Indian government and by this health ministry in putting it in this blueprint document to curtail AMR in India. So, and I think Indian government has gone one step forward, and they have come out with another document, basically trying to target organization of pharmaceutical producers of India. So, this organization of pharmaceutical producers of India came out with a Redline campaign where they supported uh, they supported the limit of over-the-counter usage of dispensing of antibiotics. So which would limit the overuse of antibiotics, abuse of antibiotics, and over-the-counter dispensing of antibiotics. So I think the pharmaceutical industry also has formed a consortium of Organization of Pharmaceutical Producers of India, and they have supported the public health centers to limit these overuse, abuse, and over-the-counter dispensing of antibiotics. So, if you look at the occurrence of the microorganisms within our community, I think no point talking about all the data from different parts of the world. We need to look at the data within Bangalore. So, if I have to look at my data, I think we did this study in 2011. So we had 104 culture positive patients, and if you look at gram negative infections, our gram negative infections was 76.92%. And this was a study by Martin et al., which came in NEGM, which came in 2003. Their occurrence of gram negative infections was only 37.6. So our gram positive infections was around 23%. As you see in the Western world, which was published in 2003, the gram positive load was 52. So where in Western world there is more burden of gram positive, but now that uh, trend also is changing in the Western world. There is resurgence of gram negative, which is taking a lead. So in India, still it remains gram negative is more of a problem, but gram positive infections also constitute significant proportion up to 25%. And if you look at the MRSA, in that 25% of this gram positive, around 20.83 was MRSA load in our in Bangalore, or if I may say in our hospital. So the summary of what the antimicrobial resistance, I think there needs to be an autonomy. So autonomy is a desire to be self-directed. So there should be a self-empowerment of every healthcare professional. It's an onerous task of every healthcare professional to drive these measures to curtail antimicrobial resistance. And I think what we see is there is a gaps in the application of knowledge, or trying to ascertain the problem of antimicrobial resistance. So there is, what we see is a gap in applying the knowledge to curtail antimicrobial resistance to clinical practice. So I think we need to fill this gap, and we need to apply this knowledge what we have, like all this forum where we gain the knowledge of anti. So you most doctors I see, I think they do understand that India is at the forefront of antimicrobial resistance and we need to curtail usage. But when it comes to the clinical practice, I don't see that intent or the resolve to minimize the usage of antibiotics. I think that gap needs to be fulfilled some way. I think when we are treating, in our zeal and enthusiasm to cure a patient, we need to bear in mind what is the impact of overusage of antibiotics on the ecology or the environment. I think that is something, or the bacteria burden in the community. I think that is something we need to keep in mind. Like for a simple example, in a typical say liver transplant setting, without offense to our transplant surgeons, I believe there is an extensive usage of antibiotics, although all cultures may be negative. So with a fear with a fear and a true commitment to do the best to the patient. But in the milli, I think we may be overusing antibiotics, and that may induce resistance in the environment. I think this is something we need to bear in mind, or even in oncology setting or in a stem cell. So there is extensive usage of antibiotics in the garb of maybe prophylaxis, or in the garb of hitting most organisms. So you would put them on gram positive, gram negative, antifungal, or and even when we talk about gram negative, okay, it may be reasonable to start, but you may be looking at putting a patient on 2-3 gram negative cover. So there should be some discretion in trying to minimize indiscriminate usage. keep bearing in mind because this induces resistance in the community. And I think treatment prescription goes a long way in putting a hold or reducing the or tempering the enthusiasm of overusage of antibiotics. But this treatment restrictions is an onerous task, and it is a team effort. So where one would need a pharmacist commitment and an administrative commitment to help this treatment or the prescription restriction to curtail use of inappropriate antibiotic. And as my friends, you would all agree that putting all these processes so is difficult. So we need to have SOP which is endorsed by the hospital treating physicians and by the hospital administration and all the other stakeholders. But I think standard operating processes have to be put in place to curtail use of antibiotics. And my friends, I would say this is not a one-off effort. It is a continuum of effort. It is a sustained effort. And most importantly, the antibiotic stewardship program should be incorporated in every organization, and this should be consistent, and it should be in sync with the ID physicians. And it is the ID physicians or the ID team that should drive this antibiotic stewardship program. So the successful antibiotic stewardship program is dependent on three domains. One is the innovative thoughts of the ID team, and the whole administration of an hospital should subscribe to this and should support the antimicrobial stewardship program. And we all understand antibiotic stewardship program is a team science, and every stakeholder involved in it should put a committed effort to make it happen. So my friends, as I would say, every ounce counts. So we can start small but think big. So always think big, think about the future, what lies in 2015. With AMR, you really do not want antimicrobial resistance as the leading cause of death, leading overtaking cancers, diabetic death, or diarrheal illness or road traffic accident. So we want it to be at the place at what it is, or even go back few steps. So thank you very much. So as I would end my talk, so we don't grow when things are easy. So I know tackling antimicrobial resistance is not easy. We grow when we face challenges. So now we are faced with a challenge of curtailing antimicrobial resistance. By taking steps, I think we only get better and we only get matured enough. Thank you very much.